business meeting and awards ceremony. It's really fun to see all of you and take a moment to celebrate all that we've done this year. We've had a huge year with MPHA, and I can't wait to share some of the highlights with you. Just a few reminders before we get started. Mute your microphone when you're not talking. It's up to you if you want to be on camera or not. Sometimes it's fun to see all the faces, especially as I'm speaking, fun to see your reactions. But of course, we understand there's a lot going on, and sometimes bandwidth is an issue. If you feel comfortable, include your pronouns. My pronouns are she, her, and you can put questions and comments in the chat. We will be doing the business meeting portion for the first 30 minutes, and then I can't wait to share the stage, the virtual stage with Ann Zakowski and Shirley Sherry for the MPHA Award ceremony at 4 o'clock. As we begin all meetings, we will read our ancestral land statement. We ask that you take a moment to honor and acknowledge that we are on the ancestral homelands of the Dakota and Anishinaabe. Indigenous people have a long-standing history and connection to the land since time immemorial and are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and US governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors and descendants, as well as the land itself. So here's some high-level things that we will be talking about today. I will give a little update on the Governing Council and our newly elected positions. We'll have a financial summary from our treasurer, Jessica Flatterud, and I can't wait to share our top 10 list put together by Mary and Emily of the top 10 things that have happened for MPHA in the last year. And then we'll touch on some resolutions and voting coming up this fall. It's going to be a big year. So first of all, it's my honor to thank several members of our Governing Council whose terms are ending. Kathy Narline has been such a great leader for us. She's finishing her term as the past president, and I just have so much appreciation for Kathy's leadership and her really careful eye. She's really looked out and been a great steward of MPHA during the last few years. She's carefully read every contract and been really thoughtful about how we've entered into a variety of topics and debates. So I appreciate you so much, Kathy. Thank you. Holly Kostrowski, a member at large, has brought a really great voice from the Duluth general area and transportation. And thank you so much, Holly, for your service on the Governing Council this year. Sharoz Charnia has been a student rep and has done tremendous work for MPHA, along with Sylvia Gutierrez, who has also been very active, especially with the Policy and Advocacy Committee, and Ku Yang, our student representative, coming from William Mitchell. So thank you all so much for your efforts and for taking time to volunteer with MPHA over the past year. Now it's my pleasure to congratulate several new members or people who are assuming new positions within MPHA's Governing Council leadership. Antonia Apollonario Wilcoxon will be our president-elect, and I'm just so delighted for Antonio to step into this leadership role. She co-chaired the conference this past year, and she brings a wealth of experience, especially from my point of view, her experience with racial and health equity, but also her experience from within the Department of Human Services. It's really complementary. She's been doing public health, but with we have so much to learn. And Yvette Ellis has just been elected as a member at large, Tolu Olilowa, member at large, and Caleb Schultz. Thank you so much, all three of you. We are so delighted to bring you into the Governing Council. I'm seeing in the comments, people are sharing things that they've appreciated about both our outgoing members, and you can also share what you're excited about for our incoming Governing Council members. It's we've all had a variety of ways to work with each other. So please do share in the chat if you have particular shout outs. This is what our governing council for 2022 and 23 will look like, the next 12-month cycle. I'm pleased to hand over the president role to Ellen Solaris. Thank you very much, Ellen. Antonia will be coming in as the president-elect. I will serve as the immediate past president and the liaison to the past presidents group. Summer Robbins will continue as secretary. Jessica Flotterud will continue as treasurer. Kristen Moore will be our affiliate to APHA, and she's on family leave right now, and Erica Fishman has graciously agreed to step in for a few months while Kristen's on family leave. Our Greater Minnesota member at large is Connie Norman, and then we appreciate the continued support and participation from Kristen Ackert and Alyssa Fritz. And then we have our 3 new members, Dr. Caleb Schultz, Tolu Oyolowa, and Yvette Ellis. And I'm sorry about first time saying your names out loud. Thank you so much, all of you, and we can't wait to get started together. So the Governing Council for 2023 also includes committee leadership. And so this slide shows who all the committee leaders will be and continue to be. We've had such great committee leaders. And as we will see when we look at the accomplishments this year, our accomplishments are due to our members and the leadership they provide, especially through committees. So we have a few open positions. The Global Health Committee could benefit from another leader. The Conference Planning Committee, Antonia will maybe looking for someone to co-lead that. The History Committee with Donna Anderson has been doing some great work, which we'll talk about. And Matt Flory has been leading policy and advocacy as Laura Klein has just finished her time on that committee as a co-lead. So we're looking for a few more leaders if anyone is inspired by this annual meeting. Thank you. Now, Jessica, I will take a moment for you to tell us about our financial status.
Thank you, Liz. Good afternoon, everybody. So as you can see from this slide, we have a healthy bank account at MPHA. As of end of day yesterday, our total account was almost $188,000. If anybody wants more specific financials, outlining, what's there, including the past year, we can provide that to you. Mary and I have been working hard with fiscal foundations and a new accountant to really streamline MPHA's financials and to have the ability to really dig in to the numbers for each committee. Over the past year, so June 2021 through this past May, our revenue was almost $193,000, expenses almost $71,000, leaving us with a net revenue of $122,000.
Thank you so much, Jessica. All right, and now for the top 10. I'm going to do a little drum roll. Yes, we hosted over 40 events in the last year. We had intersectionality conversations, we had coffee chats, skills sessions, member-led presentations, and more. And we had a fantastic policy forum series. We want to be sure to thank all of the incredible panelists and the past presidents as moderators, but I also want to send a special appreciation to Jean Streeter for her 12 years of dedication to the planning committee. This group works very hard and plans a really great series every year. And for some people, this is the primary way they know MPHA. And it always brings us new perspectives that we may not have considered. And I've really appreciated the way that Jean and the committee have curated these forums. So thank you so much, Jean. And thank you to everybody who works so hard to plan these great forums. This year, Delaney Anderson was recognized at APHA as the Outstanding Student of the Year. And it was a really well-deserved recognition. We've had some fantastic students at MPHA for the past couple of years. But Delaney, and I could speak highly, and I will speak highly of several of them. Delaney got national recognition. She designed the logo that you see on the bottom of the screen. She started out just doing our social media posts a little bit, and we connected a little bit at a coffee chat. And pretty soon she was organizing many of those 40 events, as well as overhauling our website, our content, helping us think about our content, our contact management systems, and more. So there was a lot of work that went on across the board in many different areas, but Delaney had a lot of touch points with that work, including helping our conferences for the past couple of years be virtual, but still exciting. So thank you. And I want to appreciate our 324 active members. We probably have about another, I don't know, 75 or something. Sometimes we have as high as 400 members, but in this virtual environment that we've been running for the past 2 years, having 324 active members is stellar. And that number matters, and having folks pay dues matters, because when we're doing our legislative activity, our advocacy activity, it's really helpful to be able to say, we have public health individuals and some organizations from across the state, 320 of them, who are standing behind the resolutions we're making and who agree with what we're bringing forward in our policy agendas. So there are lots of reasons to be an active member, but the number and paying your dues really does make a difference to our voice and the strength of our voice. I want to also commend our 10 ongoing and new sponsors and organizational members. Again, you know, it's been quite an interesting time for membership and fundraising and articulating the meaning of MPHA. And so it's been really wonderful to have the stalwart organizational support that we've had. And we're going to look for more organizational support over the next year in short. So thank you. Well, do you know MPHA? Would you have said MPHA has been around for 115 years, since 1907? So this past year, we celebrated the 50th anniversary of minors' consent to health services in 1971. And we really appreciated those of you who helped call attention to the importance, and especially in this moment in time when so many changes are coming politically. So thank you for that moment to celebrate and recognize that hard work. And our social welfare history archives at the U of M finished the $10,000 Minnesota Historical Society grant digitization of a public health journal tape. So if you're like me and sometimes you wish to hear Ed Ellinger pick up his guitar and sing us a song, you can now find those in the digital archive, as well as other really important parts of our public health history in Minnesota. And thank you, Donna Anderson, for spearheading that, along with Mary Grand. Our advocacy efforts have been strong this year. We testified to the House Preventive Health Policy Division in support of House File 3005 for climate and public and health program funding. With Minnesota SOFI, we partnered around and received the governor's proclamation of Public Health Week in our state. We authored a statement to affirm access to abortion as a public health issue, and we supported the governor's decision to require COVID vaccination and testing for all on-site state employees. And we signed letters of support for public health policies at the state and national levels. Three, we convened Together for Planet and Community, our annual conference this year, chaired by Ellen Solaris and Antonia Apollinario Wilcoxon. And we had nearly 200 registrants, which was our target, which meant we did a great job in terms of our budget. We had 53 presenters and authors. We had 5 plenary talks, 10 breakout sessions, a live poster hall, which was really fun, and pre and post conference sessions. It was a great moment for MPHA, and I love the vitality and the new people that we bring in during our conferences, as well as showcasing the pretty incredible public health work that's going on across the state. So thank you everybody for participating, for attending, and for engaging during the conference. Organizational highlights number 2, we raise the quality and visibility of MPHA's brand by incorporating member and public feedback about our previous logo to internally design and launch a new logo. We facilitated a website accessibility audit that resulted in actionable items for complete website redesign. And we created a new accessible color palette and style guide branded MPHA materials. It was a big lift, and we appreciate everybody's feedback and participation in this work. But the biggest thing I think we did this year, the thing that we have to really reflect on, celebrate, and challenge ourselves, take seriously what we've learned, is we conducted a huge amount of racial equity and advocacy work funded by Blue Cross and Blue Shield of Minnesota. We are so grateful to Blue Cross and Blue Shield of Minnesota for their support of MPHA and for joining us in the vision of MPHA as an organization that can reach all levels of public health, and where we can engage people working in public health and people working in government and in policy in deeper thinking about racial equity and advocacy, where we can use the positions that we're in to affect really constructive change in public health and in racial equity in Minnesota. So the first 5 things we've worked on so far are the racial equity organizational assessment. We've been looking at ourselves and how we stack up and whether we are walking the walk, and it's been really, really helpful. So we have more work to do and more reflection to do and some change, but we've started with an assessment. We took a member opinion poll. We wanted to know, do our members even support, do they agree that racism is a public health crisis? We've been saying things, we've been acting on things, but do we have the full support of our over 300, 400 members? And we do. Overall, the data was clear that our members support this direction. We undertook a leadership development project. We have really, really experienced and great leadership in MPHA, particularly with Jaime Martinez, with Melanie Peterson-Hickey, and with Erica Fishman. And together, they imagined a leadership cohort for public health, I'm gonna say young people, who, and imagined having deeper conversations about what racial equity policy and advocacy leadership would look like. And there's more detail about this coming up, but it was an extraordinary success. We did a number of member trainings, and we hope to continue to keep doing that. There is no end to the learning that we can do about racial equity and about advocacy work, and we're well positioned to do it. And we have, we're well into working on a public health collaborative with local public health associations. So finding new ways to connect with MDH, local public health, and MPHA, so that we can work more effectively at the grass tops while we are also working at the grassroots level. And now I would like to share the stage with Ann Zakowski and Shirley Sherry. Thank you all so much for an extraordinary year. It was really incredible, and I look forward to continuing to be involved with MPHA for a long time to come.
Thank you, Liz. Thank you for all of your service and all of your hard work, and we look forward to continuing to work with you. I just want to check if everyone can hear me okay. Do I sound okay, Mary? I just want to be sure. Okay, thank you. Welcome to what I think is the best part of MPHA, which is the awards ceremony where we get to honor and hold up and clap for and appreciate all the work of local public health leaders here in Minnesota. So Sherry and I chair the leadership committee. We have the honor to ask for nominations, to convene a committee that reviews the nominations and selects the awards. We then send to the governing council a list of those that have been given the award, and then that is validated by the board. So I just want to, so that's sort of our procedure. This year we had a number of nominations, a high number of nominations. It was very hard decisions to make. And we're really pleased to share those with you today. We'll be going through 8 awards plus a special recognition. And you know, the way our ceremony works is that Shirley and I will introduce the award and its history with MPHA, and then we pass it over to the person who nominated the awardee, who makes a few remarks, and then the awardee themselves says a few words. And we're hoping, I hope that the awardees received their awards in the mail. I'm hoping that's true, and they'll be able to hold them up so we can grab a screenshot of you and you'll be able to share the award. If you did not receive it, that is probably due to the United States Postal Service, which we understand just as like all of us, where there's many vacancies, and so perhaps it was slowed down, and so we recognize that as well. So with no more ado, I ask you to find your Kleenex and we'll start the show. And I'm passing it over to Shirley to introduce the first award.
Great, thank you, Anne. Can everybody hear me okay?
Mhm.
Great, good. So our first award is the Albert Justice Chesley Award, which honors an individual who has distinguished themselves in the field of public health and who have, through their membership, have made a significant contribution to the Minnesota Public Health Association. And just to give you a little history of this award, it is named after A.J. Chesley, a physician who served 54 years with the Minnesota Department of Health, 34 years as the secretary of the Minnesota State Board of Health and executive officer of the Minnesota Department of Health. So just a little bit of history. So you can see who's receiving the award, and I am going to turn this over to Stacy Stuber, who will present. And Stacy, if you can.
It will be me, Laura Bennett, one of the other coworkers at the Community Health Board.
Okay, Laura, you're on.
All right. So we nominated Julie Myra because she has been a mentor to us and other Community Health Board staff, local public health staff, and fellow leaders alike. She leads by example and expects as much, if not more, from herself as she does from those who work around her. She raised expectations and empowered people to reach them by clearing paths and providing many leadership and learning opportunities. And we know our work is better because we've worked alongside her. In her work at the Community Health Board, she was not afraid to innovate, which led to many very wonderful opportunities with region-wide grants and collaborations happening. That has led the way for many collaborations to follow and leveraging additional funds and partnerships, which has been a phenomenal outcome for our region as well. Julie is an active leader in local, regional, and state organizations, including Local Public Health Association, MPHA, and SHAC. And she was also a Robert Wood Johnson Fellowship fellow and worked on an innovative dental health project. And as a parent now myself, and with more experience in public health, I realized just how inspiring and what an incredible effort and dedication that was with everything Julie accomplished. And because of Julie's work and strong foundation, she has set the Community Health Board to be viewed as professional, collaborative, and respected organization to provide quality work. And our goal is to continue with the same integrity and generosity that Julie extended as the director of the Community Health Board while she was there, and that she continues to do in public health today. Congratulations, Julie.
Congratulations, Julie, you deserve it.
And Julie, please unmute.
Okay, thank you. Thank you. Yeah, now I see the tissue, need for tissue. So thank you so much. I'm humbled by this nomination from Laura and Stacy. And I think, thank you for thinking of me and taking the time to write this nomination. And I think so highly of you both. And it's been such a blessing for me to see you grow and flourish and make such a positive impact in each of your areas on the region and the state. So thank you so much. As I look at the past recipients of this award, I see so many public health giants, some of my heroes, many mentors to me, and I feel so humbled that I'll be listed along with them. That connection is so special, and I hope that I have paid it forward and will continue to pay it forward as well. I'm so grateful for my 35 years in my diverse career in governmental public health. It spanned those 35 years plus, and I worked at the local, regional, and state levels. And again, just loved a lot of the program areas that I practiced in, and also the variety of settings, from homes to communities to schools to jails, healthcare facilities, clinics, etc. I remember starting out as a public health nurse in my career at Carleton County, and I provided mostly one-on-one individual care. And we always say in public health nursing, womb to tomb, but actually preconception, because I was trying to work on birth control as well. And I loved the one-to-one care. That was really important to me, but I soon grew to love and value practicing at the community level and working on policy systems and environmental strategies. And while at Carleton County, I was involved in the tobacco control advocacy work related to a couple of the first few cities to go smoke-free, Moose Lake and Cloquet, and which was exciting, but also difficult when you live in a small community and you're taking on policy work that isn't always popular among friends and family. But through that early work, I learned the incredible value of the capital P policy work. It was also so exciting for me and an honor to serve as the LPHA statewide chair in year 2000 when the state passed our Freedom to Breathe Smoke-Free law. It just came full circle. And as Laura said, I loved the work at the Community Health Board. I really was able to see the value and power of collaboration and facilitating some wonderful regional programs, one of which Laura is continuing to do a fantastic job of in the area of alcohol, tobacco, and other drug use prevention. And I love the creative process I always have of program development, and also the importance of engaging community members in the assessment, prioritization, and development of a program or plan. At MDH, I went from regional to state, served as a division director of OSHI, Office of Statewide Health Improvement Initiatives, and I continue to see the importance of PSE, policy systems, environmental change, work that was community-owned, community-driven, as well as working on the big P policy related to tobacco control and obesity prevention. I also learned and really valued the importance of using that health and racial equity lens, confronting my own implicit biases. I'm still on that learning journey, humbly learning, but so appreciative that MDH put a strong emphasis on addressing health inequities, and that MPHA continues to do that work as well. And it was exciting to hear your top 10, our top 10, Liz. So one of the big reasons I stay connected to MPHA is its role in advocating for strong science-based big P policies, which are now so vital now. They're as vital as they could ever be, even more so now than ever. And MPHA is coming from governmental public health. MPHA provides that strong collective voice for public health when often governmental public health entities are not able or allowed to be heard. So again, as I close, I just want to sincerely thank you for this honor. And it's an incredibly special award, and I will treasure it. So thank you so much. Do you want me to hold up the?
If you could, yes, that'd be great.
I have this light thing going on here, but
It's not, it's Zoom. What can we say? Perfect.
Yeah,
Thank you, Julie.
Okay. Okay.
Appreciate it. I will introduce the next award, which is the Dr. Harold Howe LePink Scholarship, which is awarded to an early career professional working for local public health located in Greater Minnesota. This scholarship was established in 2021 as a memorial to Dr. LePink's pioneering spirit, innovation, and dedication to the field of public health. Dr. LePink steadfastly advocated for and was a mentor of early career professionals to advance public health practice, particularly in rural areas of Minnesota. And the recipient of this award will receive a Minnesota Public Health Association scholarship to cover a one-year membership to the MPHA and the cost of registration to the next annual conference. And Tracy is not able to be with us today, but we are asking Grace to say a few words about Tracy.
Yes, thank you. And I'm sorry that she's not able to make it. I know she's on a much deserved vacation, so I'm happy for her in that way. And I'm happy to speak a bit about Tracy. So Tracy is fantastic. So she works in Lake County. She's the public health supervisor for Lake County, which is a neighboring county to me up in Cook County. So she's also here in Northeast Minnesota. She's the public health lead for the county. And she started her position in the beginning of the COVID-19 pandemic. And that's a very challenging time to be in a leadership position in a county public health department. And especially just coming into it, she did a fantastic job. There were some definite challenges. She came in knowing that their one public health nurse was slated to leave in the near future. So she worked really creatively to try to fill the gap with contracting with school nurses, retired nurses, using the Minnesota Responds volunteer program to staff some of the really core response functions associated with the pandemic. So the biggest one is really the vaccination rollout. So she did a fantastic job. I had the honor to be kind of a neighbor and mentor to her, as I'm kind of her neighbor to the north here. And I was just constantly impressed by how creative and honest and willing to learn what all the different aspects of her position. We often joke about how now we'll have to get together and talk about the other parts of public health as the pandemic response is kind of winding down, but she's just a wonderful leader, and she really came into the position with a lot of skill in building relationships and communicating with the public, with her colleagues, and she just did a fantastic job of managing the COVID pandemic. We've connected many, many times, but I've actually never met with her face to face, even though she's my neighbor and colleague. So I'm really looking forward to congratulating her in person someday, and just kind of continuing to collaborate on a professional level as well, since we're colleagues up here in the Northeast. So I'm really grateful to be presenting this award. Very well deserved. Tracy is an absolute joy to work with and will do fantastic things in the world of public health in the years to come.
Thank you so much, Grace. Those were just such kind words, and really gave us a sense of Tracy's work. I am going to go on to the next award now. It's the B. Robert Lewis Award, and it's presented to an elected official who has distinguished themselves in aggressive pursuit to establish and maintain health as a human right and to secure optimal community and personal health. It is named for B. Robert Lewis, who served in the Minnesota Senate from 1973 until his untimely death in April of 1979. Senator Lewis was a good friend of public health. He carried many significant pieces of legislation, particularly in the areas of health and social change. And so next, I'm going to turn it over to Jaime Martinez, who will present and talk a little bit about Andrea.
Thank you, Shirley. And it's my honor and a privilege to be able to do this award, but I want to be clear that it was that Council Member President Andrea Jenkins was nominated by several folks, including Morgan Mulhern, Coco Villaluz, Judy Brown, Tam Doe, Rebecca Johnson, Kim Milbreath, Rita Palacios, Jody Broadwell, Arnie McNeese, Aaron McNeese, Dr. Jonathan Rose, VJ Smith, and several other folks like Dr. Ora Hoax and Adonis Chosa, who were Lamb Fellows and had a positive experience with Council President Andrea Jenkins. I will go forward, and then with Council Member President Andrea Jenkins, I will use the term, her name, Andrea, in this presentation. So Andrea made history in 2017 as the first African-American openly trans woman to be elected to public office in the United States. On January 10th, 2022, Andrea was unanimously approved to serve as council president. She is also a renowned writer, performance artist, poet, and transgender activist. Prior to her election in 2017, she had spent a decade in local government as a vocational counselor for Hennepin County and a policy aide to 2 members of the council. She also served as an oral historian and curator of a transgender oral history project housed at the University of Minnesota libraries. As the largest LGBTQ plus archive in the Midwest, Jenkins was vital in documenting the lived experiences of transgender and gender non-conforming people in the geographic region and across the country. She is a nationally and internationally recognized writer and artist, and a 2011 Bush Fellow, under which she worked to advance work of transgender inclusion, and the recipient of numerous awards and fellowships. Her recent work builds on her wealth of experience and engagement in community. Andrea has been committed to racial, economic, and gender justice and building leadership in populations of color, American Indians, and the LGBTQ plus community for a long time. And I'm proud to say that in 2009, Andrea served as a coach for the LAMP Institute, which was an institute funded by Clearway, Minnesota, to work on building cross-cultural leadership aimed at eliminating commercial tobacco issues. Andrea authored and passed a citywide resolution declaring racism a public health crisis. In 2020, Andrea, then a vice president of the city council, urged her colleagues in local government to declare racism a public health issue after the George Floyd death at the hands of the police. In her appeal to her colleagues, she stated, "We feel as if there was a knee on all of our collective necks, a knee that says Black life does not matter." On July 17, 2020, the Minneapolis City Council unanimously approved the resolution. The result of this resolution also led to other entities like the Minnesota Public Health Association and the House to make similar resolutions. Council President Andrea Jenkins has distinguished herself as an elected official in the field of public health, pressing for change during challenging times in the city of Minneapolis. Andrea has faced these challenges with courage and compassion, and she is a leader that we think has made significant contributions in this state. So I now turn it over to Andrea Jenkins. Thank you.
Oh boy. Hello, Minnesota Public Health Association. And just what an honor it is for me to join you all today and to be recognized for my advocacy and efforts promoting and working towards health equity for all people, and specifically transgender and other LGBTQIA plus communities, and specifically African American members of our community as well. I do want to thank Jaime Martinez for nominating me for this award. And I had no idea that all of those other nominators that you mentioned put my name forward as well. Wow, that is quite amazing. I met Jaime, as he mentioned, when I was recruited to be a coach for the LAMP program, you know, which was about smoking cessation and policy change. I would classify that work as being enormously successful. I just even read yesterday that smoking rates in the state of Minnesota are 13.5%, down from 15% in 2 years ago. And so that's a testament. We see that the FDA has banned menthol cigarettes. We passed policies banning smoking in apartment buildings. We changed the policies around who can sell cigarettes in the city of Minneapolis. And pretty soon, vaping will very likely be a thing of the past. As we know, Juul just announced yesterday that that those products are going to be off the FDA, I guess, announced that those products will be off the market. You know, getting this award though made me think about just really my long-term efforts in public health. And you know, I never really thought of it as a continuum, but it is. I mean, I was chair of the Ryan White Care Act, working with organizations that were supporting people living with HIV and AIDS. I attended in 2002 the first transgender consultation at the CDC in Atlanta, and advocating on behalf of trans and gender nonconforming folks in that realm. For over 25 years, I have addressed second-year medical school students at the University of Minnesota and the Mayo Clinic to talk about the health concerns and needs of trans and gender nonconforming people. I'm currently on the board of the Institute for Sexual and Gender Health at the University of Minnesota, which is a national organization. And so it has been a long-term engagement in really trying to address these critical healthcare needs for so many communities. And then, as noted, we were able to declare racism as a public health crisis, and that spurred on other communities and other municipalities and governmental agencies across the state to make a same or similar type declaration. And so hopefully that will move the needle on the health equity concerns that continue to plague our communities. You know, I have been really vocal about disability rights over the years, and primarily as an ally. But in 2017, I was diagnosed with multiple sclerosis, and that has moved me from ally status to literally advocating for my own life. And, you know, the reality is that we will all become disabled at some point in our human lives if we live long enough. And so that is going to be my next big battle, Jaime, is to really be on the front lines of advocating for disabled Americans and ensuring that there is access to all of the things to adequate healthcare, to access to public spaces and even private spaces. And so really honored by this award, and it inspires me to continue to fight for health equity outcomes for people. And I think we all need to be fighting for and advocating for full, affordable health care for every American in this country. It is critical. We're one of the only countries in the world that doesn't, quote, civilized countries in the world that does not have universal health care for every citizen. And that's all of our fight and all of our battle. And I will be joining elbows with you all, linking arms to create a system that takes care of all of us. Thank you all very much. I really appreciate this award and look forward to seeing you out there on the battlefield. Thank you so much.
Thank you. Thank you. I will, Councilman Jenkins, did you receive your award in the mail by any chance?
I did receive
all
my
right.
award in the mail, and
Good,
I am thrilled to display it here and also in my office, along with many other awards. But this one is really special, as like I said, it really, I think, documents a very long history of working in public health.
Wonderful. Thank you so much. Thank you.
Thank you.
Okay, we're gonna move on to the Harvey G. Rogers Environmental Health Award, which honors an individual who has distinguished themselves in public health through outstanding contribution to promote and protect the health of individuals, families, and the community. It is named for Harvey Rogers, who served for 34 years with the Minnesota Department of Health until his retirement in 1961. In those years, he earned the growing respect and admiration of his professional associates and friends who established the award in his honor. And I will pass the microphone to Jim Kelly.
Well, thank you, Ann. It's my honor and privilege to it was my honor and privilege to nominate Ginny Ingling for the Harvey G. Rogers Environmental Health Award. Ginny's been in the Site Assessment and Consultation Unit at MDH for over 20 years, and that's the unit that's responsible for investigating environmental contamination sites and providing recommendations and actions to protect public health. As a hydrologist for MDH, Ginny collects, analyzes, and interprets data about the conditions of Minnesota's groundwater. She serves a vital role in understanding which Minnesotans could be affected by contaminated drinking water from both natural and man-made sources, and then working with other state and local government staff and the public to ensure that the affected populations have access to safe, clean drinking water. Ginny's worked on numerous large and complex groundwater sites where people have had their drinking water impacted by contaminants. If you've heard of any of those kinds of sites in Minnesota, chances are Ginny's been one of the ones working hard to try to figure out what was going on and protect public health. Probably most notably the situation in the East Metro area of the Twin Cities, where tens of thousands of people had their groundwater and drinking water affected by per and polyfluoroalkyl substances, the forever chemicals that were produced by the 3M Corporation and disposed of in a number of sites in the East Metro, literally affecting the water supplies of, as I said, many thousands of people. She's gained a national reputation for her work on PFAS issues. And she co-led the Interstate Technology and Regulatory Council's PFAS work group, which was hundreds of professionals like herself developing guidance and information about these class of chemicals so that others could learn from some of the lessons that we learned along the way. In addition to maintaining a high level of competency in her field, Ginny's given back by teaching others about hydrogeology and is known for delivering well-organized, clear, and interesting presentations for not only her peers and other professionals, but also the public. Further, Ginny's always kept up in advances in hydrogeology and shared that information with others. She's also taken the time over the years to serve as a genuine and considerate mentor to several budding geologist student workers who have come through the department to assist in some of these complex sites. Ginny has a high degree of integrity and uses sound scientific principles to carry out MDH's mission. She's dedicated to protecting the health of people and the environment, taking a pragmatic approach towards this goal. Her integrity is evident in the quality and thoroughness of her work and in her interactions with others. She holds herself to high standards and expects the same from other environmental health professionals. In her interactions with the public, probably most notably, Ginny has a unique patience and takes whatever time is needed to help people understand what can be a very complex and concerning problem and helps them get answers to their questions. She's very often the last person talking with folks at a community meeting, for instance, and making sure that everyone's questions are answered. She spends a great deal of time on the phone with homeowners who are concerned about what might be in their water supply and what they can do about it to protect their health. She responds to all of these inquiries exceptionally well, providing great customer service and leaving well owners impressed with her professionalism, her knowledge, and most of all, her compassion. As a colleague at MPCA stated, Ginny has been the most valuable member of the state team, overseeing what 3M has done at the disposal sites in the East Metro and monitoring PFAS drinking water impacts in the East Metro. We wouldn't be where we're at in regards to the PFAS response if it wasn't for Ginny's expertise and dedication. And from my perspective as a colleague of Ginny for several decades now, I can attest to the fact that she's really at the top of her field. And I'm just so excited to be able to present her with the Harvey G. Rogers Environmental Health Award. So congratulations, Ginny.
Thanks, Jim. This means so much coming from Jim because we started out together working on PFAS before anybody even knew what the chemicals were. And we kind of forged a path together. So this is such an honor, first of all, to have been nominated by Jim. But then when I read the full scope of this award, I was definitely humbled to be receiving it. And then I looked at the list of the past recipients, colleagues who I've long admired, like Jim, also John Linkstein and Helen Gaydon and Kristen Robb, and other widely recognized environmental advocates like Deb Swackhammer and Judge Miles Lord. But I broke down when I realized I was on a list that includes one of my personal heroes, the late Congressman Bruce Vento. I had the privilege to work closely with Bruce on federal legislation back when I was a volunteer leader and then the state director for the Minnesota chapter of the Sierra Club. So to even be considered in the same ranks with him is just beyond imagining for me. I've spent my whole career both in the private, public, and nonprofit sectors, working to protect the environment. That was a value instilled by my parents and my grandparents. But it was working at the health department for the past 2 decades that allowed me to do this at that important intersection between public health and the environment. And I, like Jim, lucked into the work on PFAS when that class of chemicals was just being identified in the environment, and concerns regarding their health effects were just starting to emerge. Minnesota Department of Health gave me so much great support, allowing me to really dig into the science behind PFAS and then advocate for public health. And because of this, I was allowed to take some of the leadership roles that Jim mentioned and share our knowledge that we were gaining early on with other states and practitioners as they began to grapple with these chemicals. And also it allowed me to play a role both in the national and international efforts to try and address PFAS. So I feel so lucky that I've been able to do what I love for my entire career, and to work with such a great team of people who I respect and admire, and also at the same time serve the public and help to train and encourage some of the next generation of environmental health practitioners. As Jim mentioned, I've had a lot of student workers over the years. The health department is wonderful about finding funds to hire student workers, which I think is really important. Many of my student workers have gone on to careers in public health, either at the state or county or local level. I've also been invited to speak to classes at the University of Minnesota and many of our colleges, and that's always been a real thrill for me. It's fun to go to big conferences, but I really like talking to the college students. And that's important to me because I had really great teachers over the years who encouraged me to pursue a career in science long before, because I'll date myself, long before STEM for girls was a thing. You know, back in the 70s, having a teacher encourage you to pursue science was really not all that common. I especially want to call out my high school earth science teacher, Dr. Brian Tormey. He challenged me and encouraged me and instilled in me a passion for the earth and for teaching. And for that, I'm so grateful. And I'm just so honored by this. It was such a surprise. But again, I just feel that I've been so lucky because I've done a job I love for 20 plus years. My whole career, I've worked on the thing I love the most, and that's protecting the environment. So thank you so much for this award. And I know I'm supposed to hold it up. So thank you very much for the Harvey G. Rogers Environmental Health Award. It really means a lot to me.
Thank you so much, and well deserved. Next, we have the Paul and Sheila Wellstone Public Health Achievement Award. It honors an individual who has distinguished themselves in public health through an outstanding contribution to promote and protect the health of individuals, families, and the community. The awardee exemplifies MPHA's mission to promote and protect the health of individuals in the community. The awardee has led innovation, creativity, or a courageous pioneering effort consistent with professional excellence and public service. The award was renamed in 2003 in memory of the late Minnesota Senator Paul Wellstone, who served in the U.S. Senate from 1991 to 2002, and his wife Sheila Wellstone, to recognize and honor the significant contributions they both made in promoting the health and well-being of all individuals. And so it's my pleasure to turn it over to Lauren McPherson to present the award.
Hello. It is my honor to represent the Resilience and Immigration Lab, who collaborated to submit the nomination for Dr. Maria Veronica Svetez, who is receiving this award today. I was lucky enough to meet Dr. Svetez when I was in medical school, work with her closely during my residency, and ultimately joined her research team during my fellowship. She was also influential in my decision to pursue a master in public health. Dr. Svetez is and has been a visionary and inclusive leader and advocate to promote and protect the health of individuals, families, and the community throughout her career, wearing many different hats, including physician and healer, leader, researcher, mentor and educator, and advocate to advance equity for all youth, with a special focus on Latinx, low-income, and immigrant youth, families, and communities. Dr. Svetes also promoted systems change and innovation as a mentor and educator, working directly with healthcare and research professionals in training as a faculty member of the Hennepin Healthcare Family Medicine Residency Program and the University of Minnesota Medical School for 15 years. At Hennepin, she has facilitated multicultural residency programs serving the Department of Family and Community Medicine, including the Adolescent Medicine Rotation and a yearly longitudinal pathway in health equity leadership and complex patient care. At the University of Minnesota Medical School, she has provided mentorship and training to interdisciplinary professionals in leadership education in adolescent health. Dr. Svetes is continually recognized for inspiring and mentoring fellows as a highly credentialed physician, leader, and role model. Over the last few years, Dr. Svetes has led a group of interdisciplinary fellows in the creation of a dissemination translation research lab, starting with data from a MPHA Award and using community-based participatory research to advocate for the equitable and healthy development of Latina and BIPOC youth in the face of anti-immigrant policy. Dr. Svetes also has more than 2 decades as a physician and healer at both a federally qualified health center and a county safety net hospital. Within months of starting as a physician at a federally qualified health center and the largest community clinic organization in Minnesota dedicated to strengthening community well-being, located on the west side of St. Paul and serving the Latina community there, she obtained the Eliminating Health Disparities Initiative grant from the MDH to fund a MPHA or Here For You, APT, an innovative program and model developed for Latina immigrant communities who are left behind by health systems. Dr. Svetes designed and implemented APT, a direct clinic-based development program for Latina immigrant youth and families, providing bilingual and multicultural medical care, mental and sexual health coaching, health education, and referrals. She has led as medical director for over 20 years. Overall, Dr. Svetes' career has centered around promoting and protecting the health of individuals, families, and community in her clinical, education, research, and advocacy work through innovation, leadership, and mentorship.
Oh my God, I'm going to cry. So here is my award, and I'm surrounded by family here. And I prepared some words just to make sure, like I'm not, you know, that I'm a talker, right? All of you. So I'm so thankful. And that summary, it got to my heart. And thank you, Lauren, for kind of reminding myself and everyone, right, that when I started to work in Minnesota, I was very intentional about where I was going to start that work. And we did it at that moment. It was not called where people live, work, play, and learn, right? But it was that. It was trying to be positioning myself to work in the places that resonate more with my own vision and vision. Healthcare is a human right. And I wanted to be in that place where everyone could have access to that kind of care, to any type of care, to the best type of care. So I have worked in HQAC and Hennepin Healthcare, where we aim to provide every day exceptional care without exception. So I worked there for the past 20 years to create awareness about inequities of care, trying to create solutions and trying to detour investments to the community that has been historically marginalized. And for all the intentionality that I have had during the past 20 years, right? Today I wanted to celebrate serendipity. So I usually talk about that public health is my strongest muscle. And here I am today receiving my first personal award for following the step of who I consider to be my main leader, Paul and Sheila Wellstone. Both the late senator and his wife were loved and honored in this family. Each day, I try to honor their life by carrying my torch a little farther, making it a little brighter. And for you to know, I met our late senator first time like around October 2001, 3 months after becoming faculty, because he was the godfather of our clinic, the new La Clinic and Lake in Minneapolis. He was going around, he was presenting and meeting each other, and he was so charming and so warm. So he was asking me and all of us, like, what's your work? What is your specialty? And I say, I'm a family medicine physician. I have a specialty in adolescent medicine, and I have a passion and a master in public health. And he looked at me shining and he went, my favorite kind of doctor. And I didn't tattoo that on my skin, right? But I had that in ink on my soul. And I carry that every day. And every single day that I go to work, I try to embody both of them, both what our late senator did and his wife, Sheila, by advocating by victims of abuse and violence and creating rights to those who didn't have any rights. So serendipity make that today should have been my late dad 82nd birthday. So receiving this award in his birthday, it's such an honor. He taught me to never quit, and he passed me what it meant to be accountable, what it meant to be accountable at your work and in your life, rain or shine. So this brings me to my family. I have the honor to have here with me, so thanking my dad, my role model mom that is here visiting from Argentina, arriving last week, and I need to come here. My scientist, public health warrior husband, Ernesto Resnick, who led a public health effort across Latin America last year. This award goes especially to my two teams who have to endure all the hardness and the worst of the last 2 years while their parents were working day and night. And it goes to all the teens and young adults out there who suffer so much during this, within the other pandemic, the emotional pandemic. And my heart goes to our second mom in the family that is not here today. It's our Colombian mom, Mama Lily. Serendipity also, because during the most challenging years of hate crime in the last 5 years, I was sustained and I met these amazing young leaders that are my current colleagues at my lab, our lab, that became my safe space, our safe space. They are my lifesavers, they are my cheerleaders, and I have the honor to call them colleagues. So to the other MD, MPH, Dr. McPherson, to Dr. Maura Schranko, to Dr. Calabran, you are my heroes. You are my heroes. And to my community, because all this year when I was working and I was working hard, I got vicarious resiliency. They made me stronger because I was their witness. I was the witness of all the things that they were able to conquer without anything, without rights, without visibility. And so I want to thank, last but not least, to the Minnesota Public Health Association and to everyone who have been working their soul off these past years for public health, understaffed, harassed, for promoting health, for making this a reality, that we all do better when we all do better. And if we didn't learn that lesson in this past pandemic, so then when? So to all our essential workers, to all our essential parents, to everyone with those dual roles, salute. We made this world better, fairer, and safer. Thank you.
Goodness, thank you. Thank you so much. Appreciate that. Whew. Okay. Our next award is the Laura Waterman Whitstock Racial and Health Equity Award. This is the first year we'll be giving this award. And it honors a person or team who has demonstrated their commitment to advancing racial justice and health equity for American Indian, African American, Black, Latinx, Chicano, Latino, Asian American, Native Hawaiian and Pacific Islander communities, as well as individuals that are low income, LGBTQ+, immigrants, and those with disabilities. This award is a tribute and is named in memory of Laura Waterman Whitstock. She was an enrolled member of the Seneca Nation of Indians, Huron Clan. Her extensive work spanned from journalism to youth development, education to organizer. As an award-winning journalist, Waterman Woodstock authored numerous books documenting and teaching about American Indian history. She also founded the Minneapolis nonprofit MPHA that trains American Indian youth and young adults in media as a means to develop tools to tell their own stories and promote jobs. Her body of work is inspiring and reflects the intricate ways that her passion to support American Indian youth coalesced with her love of writing and her deep commitment to education to forge positive change in Minnesota and across the United States. I'm pleased to pass the microphone to Erica Fishman, who will make the introduction.
Erica, you're on mute.
Sorry. Thank you, Anne. I'm very pleased to be presenting this award to Mary Manning, who, like Laura, has dedicated her life and work to advancing racial justice and health equity in her community and in Minnesota. Mary's an innovative thought leader who has taken strong stances on important public health issues, as well as providing support and guidance to the many staff she has worked with and supervised. Also, like Laura, Mary brings her own lived experience to the table in her work. Mary holds a BS in nutrition and dietetics from the University of Minnesota and a master's in business administration from the University of St. Thomas. She was born at Mount Sinai Hospital in Minneapolis, and that hospital was significant in her life and career. At 14, she started working as a candy striper. A lot of people probably don't know what a candy striper is, but a volunteer at the hospital because her dad thought that she needed to serve her community before she started to work for money. Later, she got a job in the kitchen there. She worked there through college, and over the years, she served in many roles, including nutrition services manager. Mary started working for the City of Minneapolis Health Department in 1986 and held several leadership positions there. So her work there crystallized her understanding of the importance of addressing structural racism and health inequities at the systems level. She then joined the Minnesota Department of Health in 1997 as an assistant division director. And she brought to MDH not only her focus on improving systems, serving individuals, but also the needs of the community. And that's part of what she's done, is brought that to her whole career at MDH. From 2002 to 2020, she was the division director for the Health Promotion Chronic Disease Division. Mary's also always led by example, working across programs within and outside her division to accomplish the best outcomes. While she was in that division, she provided leadership for a shared vision on improving the health of all Minnesotans, with special attention to those who are more likely to be burdened, disabled, or die from chronic disease and injuries, including women, American Indians, populations of color, low income, and uninsured people. She has and continues to work across tribal and Minnesota government agencies. Now, working in government can be really exciting, and it can have far-reaching positive outcomes. However, over the years, there's been political pressure has been applied to staff, including Mary, and they were asked to communicate information that was not science-based. This misinformation was focused on politically sensitive topics, and Mary handled these situations professionally and forthrightly. She spoke the truth, collaborated with community partners, and looked for creative solutions to maintain the integrity of the information. This is not easy for a person to do that works for the state government, because you have the risk of being fired or demoted. However, Mary was courageous and stood firm in these stressful situations. In 2020, Mary was appointed Assistant Commissioner for the Health Improvement Bureau by Commissioner Jan Malcolm. In her role, Mary was instrumental in providing the leadership that led to the formation in March of the new Health Equity Bureau within the department. The formation of this bureau supports her vision of a permanent, long-standing MDH focus on advancing racial and health equity. Ms. Manning has made many outstanding and lasting contributions to the field of public health in Minnesota, and I've only had time to highlight a few of them. Mary's leadership has been consistently steady, thoughtful, kind, and impactful. I want to thank Janie Bruce, Jaime Martinez, Melanie Peterson-Hickey, and others who contributed to this nomination. I'm honored to be presenting it today, and I'll pass it over to you, Mary.
Well, thank you. This is just great. I was lucky enough to work with Laura Waterman Wixton in my career. She was an easy person to work with, and I didn't envision this at the time, and I'm sure she didn't either. It's really surreal. I was thinking about, when I was told about this, I was kind of racking my brain about the encounters that we had, and they were just, normal working partnerships, at phone calls. I can remember one day though, that was outside of work, the two of us sitting in a community room, somewhere in the Phillips neighborhood, waiting for, it was a political meeting, just as citizens, and just sitting together and talking. But it's just kind of surreal. I mean, just very surreal. And the other thing that's really different too is the morning after the first major damage occurred on Lake Street, I was just really relieved to see McGizzy still standing unharmed. And I called to let some of my friends know, as that was short-lived, but the organization is still alive and rebuilding. But I don't know if you could see that, but I was so excited to take that picture the morning after the first damage on Lake Street. But being from the community and, working with folks, it was very hard. But I know that the organization is alive and building, and her work is continuing. And I actually feel really lucky to actually know the person who the award is named after. I think that I might be unique in that, which makes it all much more special. I want to thank the MPHA before this award, and especially those who supported my nomination. I'm so deeply touched, and I want to thank you for those who nominated me too, for their support all of these years too. I've been blessed with plenty of examples of families working to improve the lives of others. I was lucky to hear my family's history directly from great-grandmothers, aunts, uncles, grandpas, a grandma, my own parents, and many others in my neighborhood and community, and they inspire me to do what I can do to bend the curve of injustice. And in all the places that I've worked, be it Mount Sinai, the Minneapolis Health Department, the Minnesota Department of Health, these are all places that are committed to helping others. So they're really good fits for me. And specifically addressing issues of racism has been part of their work explicitly at times. And I got into good trouble in all these places at one or more times in my career. And it wasn't always a success, but because I have and still have great colleagues and the motivation to continue, because of the joys of the successes and the motivation to continue when I'm not successful. None of my accomplishments were done alone, and good things probably hardly ever are. And although there's so much more to do and to accomplish, I'm very hopeful that so much more can be done. We're in a time of such great change and awareness. I'm very confident that there are so many people who are working hard to make the changes that we need to have a more just and fair world. But I really just want to say I can't express adequately what it means to me to be recognized by the MPHA, and specifically for this award. It is one of the nicest things that has ever happened to me, and I'm really grateful for your recognition. Thank you.
Oh, Mary, thank you so much. And thank you for your leadership. Did you get the award?
Oh, yes, I did. And I specifically was behind this. I moved my thing behind this curtain so you could see, next to this dark curtain, so you could see the etching.
Mm-hmm.
It's very pretty.
Yeah, great. Thank you so much.
Thank you.
And again, thank you for all of your leadership.
Thank you.
Okay, next we have the MPHA Student Achievement Award. It's presented to a student enrolled in a master's degree program with a concentration in public health who has demonstrated leadership skills in the contribution of promotion of the health of individuals, families, and the community. And I'm going to turn the mic over to Megan Mason to for the introduction.
Excellent. Are you all able to hear me okay? Great. Well, it is my pleasure to have nominated Sabrina Kubisa on behalf of the St. Catherine University Public Health Department. We've had the pleasure of having Sabrina both as an undergraduate student with us and now, well, not even now, she's now graduated. She's done with her Master's of Public Health degree as well. And it's just been a joy to have her in our department for the past 5 years and just watched her grow into a really phenomenal public health professional. It's students like Sabrina that make me really excited to come to work every day and really make me feel that the next generation of public health professionals are going to do great things for our communities. And specifically, Sabrina has done a tremendous amount of research, advocacy, and volunteer work in communities of immigrant and refugee communities in the Twin Cities. And I think the most kind of telling arch of Sabrina's work at St. Kate's was she, for her honors project, looked at COVID messaging in immigrant and refugee communities. She did some surveys with our students and also interviewed folks who create community health or public health messages for immigrant and refugee communities. And then she linked that work to her Master's of Public Health research activities, went through a whole IRB process on her own and just really took something that she was passionate about and is able to turn it into something useful, I think, for various organizations in the Twin Cities and the broader Minnesota public health community. She worked on designing evaluations for health communications, and I think has identified a really important gap in our work as public health professionals that often we put out messages, but we don't know what their effectiveness has been. And I think that's an area that Sabrina will continue to pursue in whatever she chooses to do next. But I also just want to highlight some of the other really wonderful activities and ways that Sabrina has contributed to our campus community and to, again, the public health scene in the Twin Cities and Minnesota. She has been a peer educator at St. Kate's, supporting students and educating them on public health issues. She most notably is part of the Young Women's Initiative Cabinet through the Women's Foundation of Minnesota, appointed by the governor's office in 2021. And this cabinet develops programming and distributes grants that address community-specific challenges and create solutions that advance equity. And she also was a peer mentor for the Multicultural and International Programs and Services Office at St. Kate's, which helps support our student body, and having those peer-to-peer connections really drives student success in our program and across the university. And just Sabrina is a joyful person, truly bringing kindness and humility to everything that she does. And we couldn't be happier for her. So congratulations, Sabrina.
Thank you so much, Dr. Mason. That was a great introduction. I am really grateful for your support and your guidance. I'm glad that you mentioned the project that I worked on. You were with me since undergrad for the honors project, and as I worked on it for my capstone project. So I'm really grateful for your guidance. I am really grateful for the Minnesota Public Health Association and very humbled and honored to receive this award. I learned from a very young age from my parents and my family how to care about issues that matter and really to care about social justice. And everywhere I go, I am reminded of the values of social justice and just equity. And being at a university such as St. Catherine University, where we really value compassion and social justice and the love of neighbor without distinction, is a constant reminder that participating in the work that matter is very important in our communities. And as I worked on my project to look at how public health professionals evaluate the effectiveness of health messages that they create for immigrant and refugees, I really found that there was a gap between how public health professionals create the messages and their intentions and how the community receives it. So I'm really hoping that I'll continue to work on these issues of communication and other issues that matter. And my goal is to keep promoting health and really participating in change and innovation in the public health field. I feel very fortunate to be part of the public health community, because in addition to really protecting life, promoting health, and preventing diseases, I think it's a vocation, and I can see in each person who went before me that calling that they've had in their lives. They've been inspired by their families just like me, and they've really put themselves into this work. And I'm really grateful and inspired by every person who went before me, and really hope to follow into everyone's footstep in the future. Again, thank you to the MPHA for this award. I'm really thankful to my professors at St. Catherine University, including Dr. Mason, and thank you to my family that's here to support me. Thank you.
Oh, thank you. Thank you, Sabrina. We look forward to seeing what's next for you. Definitely.
Thank you.
Okay, we Sherilyn and I, we almost made it to do this on time, but we just have 2 more awards. So if you could stay with us, we would love to have that. So let's go. We're going to a certificate of appreciation for outstanding service to MPHA's racial and health equity initiatives. And I'm going to turn this over to Jaime to make the presentation.
Can everybody hear me? Hello?
Yep.
Okay, thank you. I had a sign show up on my screen here. So I am really proud and pleased to make this presentation. And I just want to be clear that there were several people that nominated Morgan Mulhern Lopez, and that was Annie Holland, Erica Fishman, and Melanie Peterson Hickey. And we wanted to do this for the amazing contributions that Morgan has done for MPHA. And as I read this, you'll wonder how many people were nominated. Well, it's actually only one person, but she's quite the worker out here as a public health person. So Morgan is a new Master of Public Health graduate in Health and Social Behavior from the Harvard School of Public Health, and she just actually completed it in May. While enrolled in a rigorous class experience and extracurricular activities at Harvard, Morgan has supported Hennepin County families and medical assistance, adults experiencing homelessness, and MPHA's effort to advance racial and health equity in Minnesota. Morgan has served as part of Hennepin County's Child and Teen Checkups team, a preventative health program that serves families with children, teens, and young adults enrolled in medical assistance. In addition to her daily responsibilities, Morgan took it upon herself to also actively lead several community-centric initiatives to tackle health inequities. In response to the pandemic, Morgan was deployed to serve Hennepin County residents experiencing homelessness as a site leader at several decentralized shelter sites throughout the county. With Morgan's support, these sites effectively protected adults experiencing homelessness that were at high risk of hospitalization if they had contracted COVID-19. While working as a student and full-time employee at Hennepin County, Morgan was also deeply involved with MPHA. As an MPHA intern with the Health Equity and Policies Committee, she authored an MPHA resolution declaring racism as a public health crisis, in addition to other resolutions that contributed greatly to MPHA's work. But by the fall of 2021, Morgan moved to Boston to attend Harvard full-time and was also promoted to serve as the project manager as part of the Racial Equity and Advocacy Initiative at MPHA. In the project, Morgan excelled, and her role was to spearhead a leadership development program aimed to build a pipeline of equity champions that identify as early career professionals of color or American Indians, and has shepherded an internal assessment of MPHA policies and practices and a membership poll on racism as a public health crisis. We are just so proud of to recognize Morgan for her achievements at a very tender age. And we know that she will continue to grow and help advance racial and health equity wherever she is at. She's an amazing person to work with. And I'm gonna turn it over to Señorita Morgan Mulhern Lopez.
Oh, thank you so much, Jaime. It's so beautiful to hear it coming from you too. I kind of came to Minnesota. After undergrad, was taking care of my grandma in Miami and ended up in Minnesota working in community health and public health. Minnesota is really where my roots are with public health. It's where my journey started as a community health worker and where I really started to feel super fulfilled in my work and I just worked with such wonderful coworkers at Hennepin County that were so committed to advancing health equity. And we did a lot of projects around oral health equity. And then working with folks experiencing homelessness and then connecting with MPHA, I just started to build so many connections with all of you that are here today. And I'm so grateful for that. And I really see all of this work coming into fruition now. Just before this, I found out I accepted a job offer to work at Pine Street Inn, which is, they do a lot of housing and emergency response for folks experiencing homelessness, and they're looking for somebody to also do more evaluation around racial and health inequities within their programming. So I really see all of this coming together, and I really wouldn't be here without MPHA's support. And I'm so grateful to all of you as mentors, and I really admire each and every one of you that's on this call. I think there's just such a perceived and real tension of population health and advancing health equity in public health. And seeing all of you here today and all of you being recognized, I just feel like so much hope that together we really can do it. And thank you again for this recognition. It is so meaningful to me. So thank you.
Thank you, Morgan. Morgan, do you have the certificate? Where'd she go?
I'm so sorry. I'm not at home. I'm actually working in California right now, so I don't have it.
Okay, we'll get it another time. No worries. Thank you so much. We have one last special appreciation. So I'm gonna turn this over to Mary, who will introduce this appreciation award certificate.
Thank you, Shirley, and hello, everyone. I'm Mary Grand, MPHA's Executive Director, and I hope that everyone has been as inspired and thankful for all of the amazing public health nominators, awardees, everyone who has come together to celebrate public health today. As an organization, MPHA has been doing tremendous work, and we are a volunteer-driven organization. I'm part-time, and I can't say enough to thank our other part-time person who helps with everything behind the scenes. You have no idea how many hours of work she puts in to make things just right for MPHA. So I would like to thank our part-time engagement specialist, Emily Akers. And Emily, I know you may not have anything prepared, but it's important for us to recognize how much work is going on behind the scenes. All the communications that you get helping coordinate things with MPHA. Emily pretty much has a hand in just about everything. So Emily, we are so honored to recognize you and say thank you for all of your work. It will be exciting to see where everyone who was awarded today goes with their future careers. Emily is considering some doctoral programs in her future, so we are excited for her future as well.
Well, thank you. I don't have many words to say, just except, again, thank you for everybody. I love working with all of you, and for MPHA. Like, I am so touched and honored to literally get to work with every single one of you pretty much every day. I have touch points with most of you via email, which is awesome. And it's awesome to be on calls like this and events where I get to see and hear all of the incredible public health work that is being done. And I feel just like so honored to be working alongside all of these incredible public health people. And so, yeah, just thank you. Thank you for recognizing me, and for everybody else here does too.
Yes, thank you so much, Emily. And you're such a great communicator. So let's give everybody a round of applause to all of our awardees. Thank you, thank you, thank you. And I would just like to remind everybody to think about deserving public health leaders in our field and plan to nominate them for next year's awards event. Just to keep that in the back of your head. And Mary, I didn't know if you wanted to say this, but of course, stay connected. If you're not a member, please consider becoming a member. We've got trivia night coming up on June 29th from 7 to 8 o'clock. And you can follow us on our social media platforms at MN Public Health. So thank you. And this concludes our event.
Thanks, everyone.